Hi everyone, this is Nicole. I wanted to do a quick little review for you guys to look at this evening over the heavy and more difficult chapters that will be on the final exam. Those chapters are going to be the respiratory chapter, cardiac, the endocrine, and the pediatric chapter. Hopefully you guys have been studying. And you guys are going to do great. I know you're going to do great. So I just wanted to come on here and do a quick little review just to make sure that there's nothing that you guys are going to miss, and hopefully we'll help you out a little bit. Just a quick little review. Okay, so this first one is going to be the respiratory chapter. Okay, in the process in which oxygen and carbon dioxide are exchanged in the lungs is called respiration, ventilation, metabolism, or inhalation. So A, respiration. Which of the following respiratory diseases causes obstruction of the lower airway? Croup, asthma, epiglottitis, or laryngitis? B, asthma. Which of the following diseases is potentially drug resistant and is thought to be transmitted by coughing? Tuberculosis, croup, diphtheria, epiglottitis. A, tuberculosis. All of the following are causes of acute dyspnea except asthma, emphysema, pneumothorax, pulmonary embolism. B, emphysema. Bronchospasm is most often associated with asthma, bronchitis, pneumonia, pneumothorax. A, asthma. A sudden onset of difficulty breathing, sharp chest pain, and cyanosis that persists despite supplemental oxygen is most consistent with severe pneumonia, myocardial infarction, a pulmonary embolism, or a spontaneous pneumothorax. C, a pulmonary embolism. Albuterol, a beta-2 agonist, is the generic name for Alupent, Metaprel, Brethine, Ventolin. D, Ventolin. An acute bacterial infection that results in swelling of the flap that covers the larynx during swallowing is called croup, laryngitis, epiglottitis, diphtheria. C, epiglottitis. A 70-year-old man recently had a heart attack and now complains of severe difficulty breathing, especially when lying flat. He is coughing up pink, frothy secretions. The patient is most likely experiencing an acute right heart failure, severe left heart failure, an acute onset of bronchitis, or an acute pulmonary embolism. B, severe left heart failure. Which of the following patients is breathing adequately? 36-year-old man with cyanosis around the lips and irregular respirations. 29-year-old woman with respirations of 20 breaths a minute who is considered conscious and alert. 20-year-old man with labored respirations at a rate of 28 breaths per minute and pale skin. 59-year-old woman with difficulty breathing whose respirations are rapid and shallow. B. 29-year-old woman with respirations of 20 breaths a minute who is conscious and alert. Okay, so let's move on to Chapter 16. Oops. They've since changed their site, and it confuses me. That's not what I wanted. All right. All of the following are common signs and symptoms of cardiac ischemia except headache, chest pressure, shortness of breath, anxiety, or restlessness. A. Headache. While palpating the radial pulse of a 56-year-old man with chest pain, you note that the pulse rate is 86 beats per minute and irregular. This indicates pain, fear, anxiety, dysrhythmia. D. Dysrhythmia. A 56-year-old man who has had an acute myocardial infarction, which of the following blood vessels became blocked and led to his condition? Coronary veins, coronary arteries, pulmonary veins, pulmonary arteries. B. Coronary arteries. Major controllable risk factors for an AMI include older age, family history, cigarette smoking, male sex. C. Cigarette smoking. A patient with cardiac arrest secondary to ventricular fibrillation has the greatest chance for survival if CPR is initiated within 10 minutes, oxygen and rapid transport are provided, defibrillation is provided within 2 minutes, paramedics arrive at the scene within 5 minutes. C. Defibrillation is provided within 2 minutes. A 59-year-old woman presents with chest pressure. She is conscious and alert, but her skin is cool, pale, and clammy. Your first step in providing care or treatment should be apply the AED, administer oxygen, ask her if she takes nitroglycerin, or take a complete set of vital signs. B. Administer oxygen. If a patient with an implanted pacemaker is in cardiac arrest, the EMT should avoid defibrillation with an AED and transport at once, not apply the AED until he or she contacts medical control, place the AED pads away from the pacemaker, apply the AED pads directly over the implanted pacemaker. C. Place the AED pads away from the pacemaker. The main advantage of the AED is it provides quick delivery of shock. It is easier than performing CPR. There is no need for ALS providers to be on scene. All of the above. So the answer is D, all of the above. After administering a nitroglycerin tablet to a patient, the EMT should check the expiration date of the nitroglycerin, reassess the patient's blood pressure within 5 minutes, instruct the patient to chew the tablet until it is dissolved, ensure that the nitroglycerin is prescribed to the patient. B. Reassess the patient's blood pressure within 5 minutes. Nitroglycerin is contraindicated in patients with a systolic blood pressure less than 100, with chest pain of greater than 30 minutes duration, who are currently taking antibiotics for an infection, who are younger than 40 years of age and have diabetes. A. With a systolic blood pressure less than 100. That was cardiac. Let's now move on to endocrine. I have to do this all over again because I don't know how to go back with the new system. I just logged in today and saw that they have updated everything. Type 1 diabetes is a condition in which too much insulin is produced, glucose utilization is impaired, too much glucose enters the cell, the body does not produce glucose. So B, glucose utilization is impaired. A 45-year-old man with type 1 diabetes is found unresponsive. Which of the following questions is most important to ask his wife? Did he take his insulin today? How long has he been a diabetic? Has he seen a physician recently? What kind of insulin does he take? A. Did he take his insulin today? A diabetic patient presents with a blood glucose level of 310 and severe dehydration. The patient's dehydration is a result of excretion of glucose and water from the kidneys, a deficiency of insulin that causes internal fluid loss, an infection that often accompanies hyperglycemia, or an inability to produce energy because of insulin depletion. A. Excretion of glucose and water from the kidneys. Which combination of factors would most likely cause a hypoglycemic crisis in a diabetic patient? Eating a meal and taking insulin, skipping a meal and then taking insulin, eating a meal and not taking insulin, skipping a meal and not taking insulin. B. Skipping a meal and then taking insulin. A 19-year-old diabetic male was found unresponsive on the couch by his roommate. After confirming that the patient is unresponsive, you should suction his oropharynx, manually open his airway, administer high-flow oxygen, begin assisting his ventilations. So B, manually open his airway. What breathing pattern would you most likely encounter in a patient with diabetic ketoacidosis, also known as DKA? Slow and shallow, shallow and irregular, rapid and deep, shallow and irregular. C. Rapid and deep. A woman called EMS because her 12-year-old son, who had been experiencing excessive urination, thirst, and hunger for the past 36 hours, has an altered mental status, and is breathing fast. You should be most suspicious for low blood sugar, hypoglycemia, hypoglycemic crisis, hyperglycemic crisis. D, a hyperglycemic crisis. If the cells do not receive glucose, they will begin to metabolize fat, acid, sugar, or ketones. A, fat. Oops. In contrast to a hyperglycemic crisis, a hypoglycemic crisis, D, usually responds immediately after treatment. So let me read that one again because I feel like I made that confusing. In contrast to a hyperglycemic crisis, a hypoglycemic crisis usually responds immediately after treatment. Okay. Patients with diabetic ketoacidosis experience polydipsia because they are dehydrated secondary to excessive urination. The cells of the body are starved due to a lack of glucose. Fatty acids are being metabolized at the cellular level, or hyperglycemia usually causes severe internal water loss. A, they are dehydrated secondary to excessive urination. When dealing with hematologic disorders, the EMT should be familiar with the composition of blood. Which of the following is considered a hematologic disease? Sickle cell disease, hemophilia, Lou Gehrig's disease, or both A and B? So D, both A and B. Both sickle cell disease and hemophilia is a hematologic disease. What are the two main components of blood? Erythrocytes and hemoglobin, cells and plasma, leukocytes and white blood cells, platelets and neutrophils. B, cells and plasma. The assessment of a patient with a hematologic disorder is the same as it is with all other patients an EMT will encounter. In addition to obtaining a sample history, EMT should ask which of the following questions. Have you had a crisis before? When was the last time you had a crisis? How did your crisis resolve? All of the above. So D, all of the above. Sample is the mnemonic used in taking the history of all patients. In addition to asking the sample, EMT should also ask about past crises. Which of the following is not an appropriate treatment for EMTs to provide to a patient who has a hematologic disorder? Analgesics for pain, support of symptoms, high-flow oxygen therapy at 12 to 15 liters a minute, or rapid transport? A, analgesics for pain. Okay, so that was endocrine. We have one more. Where's it at? How does the pediatric anatomy differ from the adult anatomy? The trachea is more rigid, the tongue is more proportionately smaller, the epiglottis is less floppy, the head is proportionately larger. D. The head is proportionately larger. When a small child falls from a significant height, the blank most often strikes the ground first. Head, back, feet, side. A. The head. When assessing a conscious and alert 9-year-old child, you should isolate the child from his or her parent. Allow the child to answer your questions. Obtain all of your information from the parent. Avoid placing yourself below the child's eye level. B. Allow the child to answer your questions. The purpose of a shunt is to minimize pressure within the skull, reroute blood away from the lungs, instill food directly into the stomach, drain excess fluid from the peritoneum. A. Minimize pressure within the skull. Which of the following statements regarding febrile seizures is correct? Febrile seizures usually indicate a serious underlying condition, such as meningitis. Most febrile seizures occur between the ages of 2 months and 2 years of age. Febrile seizures are rarely associated with tonic-clonic activity, but last more than 15 minutes. Febrile seizures usually last less than 15 minutes and often do not have a postictal phase. D. Febrile seizures usually last less than 15 minutes and often do not have a postictal phase. You respond to a sick child late at night. The child appears very ill, has a high fever, and is drooling. He is sitting in a tripod position, struggling to breathe. You should suspect croup pneumonia, epiglottitis, severe asthma. C. Epiglottitis. Treatment for a semi-conscious child who swallowed an unknown quantity of pills includes administering 1, I'm assuming gram per kilogram of activated charcoal and rapidly transporting, monitoring the child for vomiting, administering oxygen and transporting, positioning the child on his left side, elevating his legs 6 inches and transporting, contacting medical control and requesting permission to induce vomiting. B. Monitor the child for vomiting, administering oxygen, and transport. When using the mnemonic child abuse to assess a child for signs of abuse, you should recall that the D stands for delay in seeking care, divorced parents, dirty appearance, disorganized speech. A. Delay in seeking care. A 4-year-old girl fell from a second-story balcony and landed on her head. She is unresponsive, has slow, irregular breathing, has a large hematoma to the top of her head, and is bleeding from her nose. You should immediately perform a full-body scan to detect other injuries, administer high-flow oxygen and transport at once, apply a pediatric-sized cervical collar, administer high-flow oxygen via pediatric non-rebreathing mask, and prepare for immediate transport. Manually stabilize her head, open her airway with the jaw thrust maneuver, insert an airway adjunct, and begin assisting her ventilations with a bag valve mask, or suction her airway for up to 10 seconds, insert a nasopharyngeal airway, apply a pediatric-sized cervical collar, and administer oxygen via pediatric non-rebreathing mask. So the answer is C. The AVPU scale is used to monitor a patient's level of consciousness. What does the P stand for? Pallor, pediatric, painful, pale. C, painful. All right, that is all I have for you guys for pediatrics. So we have covered the chapters of respiratory, cardiac, endocrine, and pediatrics. We did that in a nutshell. I hope that you guys have taken the weekend to really study all of the chapters, and I know that you guys are going to do great on the final exam, and you're also going to do great on the National Registry. It was a pleasure being your iBest instructor, and as always, if you have any questions, feel free to reach out to me, and you can always reach out to Buddy as well. Good luck, and I will see you all tomorrow in class.